Hey guys, welcome to another SOS sponsor podcast. This year we have back a return sponsor, and actually somebody who, since last year, I've started working with, and actually as a direct result of some of the conversations we had around the SOS sponsorship. So kind of excited to have Faiz here and Digital Auxilius. So give you guys a couple of minutes each and tell us what about yourselves and sort of your journey into clinical research, if you would.
Oh, definitely. I think it's been a very interesting journey. We started Digital Auxilius as a digital marketing software development company. We do website development. Main focus has always been branding. I got into research through one of the customers that was our very early customers. We started working with them in 2020 and started learning about research of how it works, how to get more patients, how to do branding. And I think right from the get go, we realized that it's a very different market where the sites are not even aware of what they need to do. So there are these mega conglomerate, like huge sites that are doing everything and reaping the benefits. And then there is the rest of the 80-90% that are barely trying to hang on with their day-to-day work, that they don't even know, okay, what is branding? What do I have to do? What is search engine optimization? How do I bring in more patients? So it's a dilemma of, like, you have to put in money to bring in patients. You have to bring in patients to put in more money. So I think that's where I started. My first conference, I went to SCRS when I realized, okay, this is a big thing. Slowly we grew. We started doing more sponsorships. We started getting more customers. But like to this day, I think we try to work with less customers and have a more direct online conversations with them. Like, I think we also work with Hightower, right? And it's not that it's just one thing that we do, that okay, we'll just run an ad for your one campaign, but it's rather a one-stop solution where you might need something custom developed for your site, and you might need something for your website, for SEO, a referral program. How many sites out there even know that you can get a referral program IRB approved, where you can have actual ambassadors, um, you know, doing or referring patients to your sites, and it can be IRB approved. So I think it's been a very fascinating journey learning through it, and we've been adding more and more and more people. Where our team has grown over 100 people now, and like, we're working with a lot of sites. But again, that one-to-one connection is still there, and that's what got me excited about research, in understanding. Okay, it's a totally new market. Nobody is really doing branding. I think you ask any of the sites, barely any of the sites are actually doing their own branding.
Yeah, I think that's, I mean, something that has always sort of occurred to me until, started working more with you guys. I think that's something, sites, at least we wanted to do and didn't really know how best to do that. So having somebody to help along the way, and, I can certainly attest to you guys having a very hands-on approach, because I mean, we can be a pain in the ass to work with, because we're like, no, 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 we want this detail different, but that's important for sites, I think, too, to a certain degree, to have that level of, you know, I think each site has its own sort of message, vision, whatever that may be. So to be able to, include that in your branding or marketing, whatever the case may be, is nice, and like we've really appreciated that. And to your point, being able to customize things, like we're trying to have an employee portal like in the background of our website, something that we wouldn't really know how to like execute well, but something you guys have been able to help start us getting on down that path. So yeah, no, I've loved it so far, and I think again it's something we've probably undervalued a lot until the last year or so we started really working on it.
Definitely. And it's a few of those things, right, that you never know unless you start doing it. And it's all the small things that you need for your site, but you lack the infrastructure on the tech side, because not everything can be solved by a CTMS. Not everything can be solved by like a huge product that you undertake, but like, something small, like you may need forms to automate your access requests. You may need a small training portal, but you don't want to go out and pay like tens of thousands of dollars every month to have a training portal where all you're doing is just basic, like recording all of your certifications or doing basic onboarding trainings. research requires a lot of training. I think we recently worked with another company. I mean, that's something, Brad, that you also requested, but there's another company that requested saying that, hey, we have all of these tasks on our delegation logs, and we don't even know like how do we train our staff to it. We have some trainings, but we don't know how to track that. If I am assigning someone a data entry role, have they done a particular training for that role or not? So we built that training portal for them, where they have those designated trainings that they do. They maintain those certificates and manage everything accordingly, and that's a fraction of the cost, one-time fee, they're done.
Yeah, I will say, especially for smaller sites, I think it's extremely affordable too, which I think is a huge advantage. Again, when sites it's like you talked about. Sometimes it feels chicken or the egg. Like you got to spend a little money to bring in, ideally, a bigger return on investment. But I think a lot of sites are often scared to make that initial investment, and I know it's something even we were probably slow to come around to doing. So it being affordable is a huge advantage for especially the smaller sites out there. Very cool. What about you? Awful quiet down there. Is it Kazar?
Yeah, it's Kizzer.
Kizzer, sorry.
Well, no worries. And nice to meet all of you on the call. And I think this is our first time kind of getting to know each other. And I have to say, Brad, I like that sneaker wall behind your back. That's awesome. Are those some fours back there, or just kind of scattered through?
Oh yeah, a little bit of everything.
No, that's awesome. No, I love it. But apologies, I lost my voice. But I've had an interesting journey into product leadership. My background's kind of somewhere between clinical research, operations, and business strat. And I've always been super passionate about how can we leverage technology in this field, and how do we improve these efficiencies, and how do we expedite our decision making. So what I'm hoping to speak about during today's call is Syncora. And that's at the forefront of what we're trying to do. And so as a CPO at Syncora, I focus on kind of how do we create that innovative solution that streamlines the overall process. So we're hoping to enhance collaboration and just ensure to the users that, anyone from a research professional to an executive can, kind of seamlessly operate within this complex environment and understand where they're standing, especially with that study startup pipeline. So, in this role, I'm kind of a between strategic vision, user design, and execution, but, just making sure that our product really maps really well with what the industry needs right now. And so that's what we've been able to kind of create, is that trial management software.
Yeah, so I mean, our experience has been, with the website marketing, sort of advertising, and even tying that into CTMS, something that Dax has helped us a lot with. This is the first time I'm hearing about Syncora, so I'm kind of curious. Tell me a little bit more about what does it do? What is it?
So I mean, perfect question. I think, as everyone knows, how do you kind of manage your current trials, right? Like when you're getting feasibility, I'm assuming that it's going to be all being done over Excel sheets. It's going to be done very manually. And so really what Syncora does is, it's developed kind of like a CRM, but we've done something that, I don't think really exists in the industry itself right now, which is, excuse me, is we've been able to kind of create a task management platform that really allows for reporting, for just understanding of where you're in your overall organization, for the delegation and handoff of those tasks. So it's pretty it's a very different approach to that entry level study startup process, and I think it really kind of puts together those pieces of information that you sometimes can get lost when you're dealing with hundreds plus clinical trials and you're inputting all this information. And when you want to find out where your studies are and have a better outlook and overview, that's what our product's really offering to the market.
Yeah, I feel like that's something that's been lacking a little bit, and I've always been curious when someone's going to come up with a good solution that is sort of like CRM, task management, CTMS. Some of the CTMS systems sort of have it, but not, I found, in a very robust way. And then otherwise you're trying to look at stuff like I don't know, Asana or like these other sort of project management tools that oftentimes become like really expensive if you want to have a bunch of seats for all your coordinators, and it feels like overkill. Otherwise, people are operating out of their inboxes, which are kind of like siloed away, so you don't really know who's done what when. So no, I love that idea. Is that something you guys is already rolled out and like in production and commercialized, or something you guys are still building right now?
Yeah, feel free to check us out in Syncora.com. We rolled it out last year, I believe, at SCRS. And so, we'll be presenting at this year's conference for Save Our Sites. And yeah, it's fully operational. Actually, one thing we want to kind of offer for the first 10 sites to kind of onboard with us during Save Our Sites, we want to offer it for free for, I believe, 2 months. So if anyone's interested, or even yourselves, we'd love to kind of show you the product, pilot it out, and let you kind of get a first-hand experience on how everything operates.
I love that. So if you guys are listening, come into SOS, find these guys, and make them give you free software, right? I mean, come on.
So just a quick question. I know all of you have some sites experiences where you're working on your sites. How are you managing your study startup?
Yeah, so I think it was pretty similar to what you described. There's no one system that works best. I do have a CTMS system. So we do, for example, upload all our electronic regulatory. There's a checklist our regulatory team uses. But prior to that feasibility, honestly, I'm using an Excel sheet. I've tried to look at various systems to see if something works better. I haven't yet to find one that works. So I'm looking forward to your company or others that develop something that it can transition that to something else. Because I think it's we're like using various things to complete that process, right? Because it's not one thing that incorporates everything. I think that's a challenge on my end. I don't know about the rest of you. And so I'm still looking for the best systems that work best for my site. Mm-hmm.
Yeah, same on my situation. I'm using a CTMS, and recently I started using Biogenesis for the feasibility questionnaires. But other than that, different older platforms like Inato and this, but not one that has everything together. Yeah.
And yeah, I referenced Asana. That's what we use. So we've built out like these study startup. Actually, our whole like life cycle of a trial, built out some templates, and you can assign, the tasks to my regulatory person, to my budget, to contracts, to BD, and we all can kind of communicate within that portal. It's kind of nice. You can drop files in from like your inbox, but like I think the front end it's missing. So like, I used to like HubSpot CRM because it would keep a running tally of like a conversation I'm happening. That doesn't really happen with Asana. It's more like after you get to that point, you can dump it out. You've already got all your preset tasks that get auto assigned. You click them off as they're done. Anyone can look and see how it is. But again, it's kind of pricey for what it is. And I definitely don't I don't want to add all my coordinators in, because then I'm running up the costs. And it was a lot of work to sort of like build it out on the front end. But that's how we're sort of managing tracking and getting, just really tracking our study startup. Yeah, the feasibility, I think, is still tough, especially when feasibilities come in a PDF form, in a platform, or a number of platforms, in SIP, in all kinds of different ways. Like, how do you take that data, keep it meaning? Because again, I don't want to fill out the same numbers about IBD 10 times, but I have to go ask, like, we should be able to reuse that data as much as possible. And that's been tricky, I think.
And then there's old school. You utilize, in terms of regulatory, CRA nagging, right? You need to get this done. So I know a couple of our sites do that. Most of our sites, though, we utilize many different versions of software.
Yes. So I think that's essentially what it is that everybody has a system that is partially working for them, and they always have some trade-off that they're making, that they're like, okay, I would love to do this part, but I don't do it because of so-and-so. It could be cost, it could be feature issue, or it could be something like that. And that's essentially why we built Syncora, was that, we have this product. that from the point that you get a lead, it could be from anyone, any of the sources that you're getting those leads to, sponsor, CRA, vendor, whatever. So you get a lead for a study, and then where does that go? Who's going to follow up? If you have multiple sites, who are you going to assign? Are you saying yes? Are you saying no? So the whole goal is understanding where the ball is. Like, is it in your court? Is it in sponsor's court? If it's in the sponsor, CRA, whoever's court, then you have to follow up. So majority of the times, I think majority of the sites lose out on a lot of the studies is because they don't even know where those studies are in the pipeline. It started when we were doing like a discovery call for marketing for one of the research sites, and we were like, okay, how many more studies do you have that are upcoming? That way we can give you a pricing plan. And they were like, oh, like, there are a lot. And then they gave us like some number of 100, but I think only like 10 started. So they were sure that about 100 would start, and only 10 started in the next 6-7 months. So then we were like, okay, like what went wrong? And they're like, oh, like we don't even know where those studies are now. So some of those studies were stuck in finance, some of those studies were stuck in feasibility. So then we built this program with the first approach in understanding where things are, and then with the approach of reducing the timeline for each thing. So for example, feasibility questionnaire, I'm sure there's a lot of software out there that are using AI to help you answer feasibility questionnaire. So we have a similar thing where there's a plugin, you use that, it helps you answer all of your feasibility questionnaire, reduces your timeline. And then the third thing that we've built through the software is the analytics in understanding what your weak points are. Is it that you are not answering the feasibility questionnaire right? Is it your finance team is taking more than a month to negotiate a budget, or more than 6 months to negotiate a budget based on how you are? So that understanding as a site owner, as a director, that where your site stands, what is your pipeline financially, how much money you should expect, or things like that, which I think is very important for you to even know where your site is and where you're going.
Yeah, again, I think it's stuff that's challenging to do without a good platform to do it and be able to see it all in one place. Because otherwise, and to Chris's point, like if you're a small site, like yeah, maybe you can get away with. I mean, when we had 3 people, it's easy to walk down the hallway and like, hey, what are you doing? Where are we at? What's going on? But even then, I don't think you can get a good, bird's eye view of how long these things are taking. And it's a question we deal with every week. We meet even constantly, and we're still wondering like, okay, who's sitting on a budget? Is it us? Is it a sponsor? It's almost always the sponsor, by the way, but nonetheless. But to actually be able to track and have those metrics, I think, is incredibly important, and something that, I think, again, it's just incredibly challenging to be able to do without some kind of good tools to back it up.
Definitely. What about branding? I think branding in terms of the sites, I think Judy and I have talked about branding a lot. Like we were in a group at SCRS, I think breakout group, and we talked a lot about it. What about others? Like what do you think about branding on the site level? Like how do you do it, and what are your goals? How do you achieve it?
Yeah, that's a good question. And I don't know, frankly. I mean, honestly, that's why we're working with you guys, is to help, sort of, work through that. I think that's something that's been challenging. I guess in some ways I've been able to, build sort of self-branding through like LinkedIn, but like thinking about how to do that with a site, I feel for some reason like lost on how to even start that. So that's always been a challenge in my mind. So yeah, I think for me, it's easier and probably smarter and quicker to, work with someone who knows how to do that stuff. But that's just been my, experience with it, I guess.
And Faiz, quick question. When you mean branding, are you mean branding your site to sponsor CROs, vendors, or branding your site to the community in order to recruit more participants? What are you talking about? Both?
I think all stakeholders, like, you have to brand to patients, you have to subjects, you have to brand to sponsors, you have to brand to CROs. Sometimes you have to brand to principal investigators and other people who might be looking for jobs. I think that's finding the right CRC. That's a big challenge for a lot of sites. So again, like branding as a company that people can come in and, work with in whatever capacity that they may be.
Yeah, I think that's, always a challenge for a lot of sites, depending what size they are. Because you have to take on this marketing role, right? That we don't really have that background. So if you find the right company to work with, like yourself, who can help you in that, but I also, depends where you're at and what your focus is and your resources financially, what you can put out, right, for that. But it is a lot of work, because I think that's something we've worked on over the years to grow and add on to our site. And it's a lot of time and effort that goes into it. But I think if you do it right and you work with the right individuals, organizations, you'll definitely get your name out there in the community, as well as the other site sponsors, Sarah's. It's just working with the right individuals to get you there.
Yeah, I have done similar, but obviously not as strong as Judy. But we have done in digital media, and also with the community. And what is that's doing with that? What is what you guys are offering in that regards?
Of course, and I think that's one of the strongest suits that we have, which is how do we build a research site as a brand itself. So a lot of times, and then I know that all of you are very well known on LinkedIn. Everybody knows Brad. Everybody knows Judy and the things that she's doing, and others, Dan Sfera. So the audience that you are showing all of your work to are research professionals, right? It might work very well with getting sponsors. It might work very well with getting more people to work on your sites. But to the general public, and that's like one of the posts that I saw with Brad, was that, what are we doing to let people know that research is an option, that research, they need to participate in it. So the general public knows nothing about research. Majority of the people think, I'm a guinea pig, I don't want to be there. And some people may join thinking, oh, I'm going to get paid some money. But what are actionable items that people are doing to actually become a voice in the general community that research what it is, how do we do it? So the way that we do it, Monica, to answer your question, is that we build the entire brand. So there's a full journey. So we do like a free audit for the sites and just understanding what is needed. Just starting with building your brand from the ground up, starting with like making sure that small things, that you have a profile on Google, you have a profile on Apple, people can find you in different ways through search engine optimization. I think with Brad, when we started, there was zero traffic on the website in November 2024. Right now, I think according to Href, which sometimes is up or down, I'm seeing 12,000 people that are coming on the website. There's over 100,000 impressions that people have seen Hightower Clinical in some shape or form. So how is that achieved? That's achieved through search engine optimization, through the general branding that you wouldn't know from your peers, but this is something that you would see in numbers of how many people are actually seeing the blogs, how many people are, quoting you that, oh, clinical research is an option. So that's what we do in building the full 360-degree view of your site for all stakeholders through search engine optimization, through marketing, and then through that we also run targeted ads to bring in patients for your sites. And that's one of the areas that maybe we can talk about, which is a lot of the times sites don't even know how to utilize their marketing budget to even ask for a marketing budget, because then there's a hassle of how you use it, how you're going to work through it, are you going to get enough patients or not, and then they're losing the money that's on the table just because they don't even have a plan to execute it.
Yeah, and I do think it's tricky for sites. I mean, there's a comment in the stream that kind of touches on it. I think, a lot of times for us, the way through is through the physicians in which we work versus like being known as a research standalone sort of research organization. But I do think there's a lot of advantage, because we still call people up and be like, Hightower Clinical, I'm like, well, what the hell is that? Not just the research question, but then who you are in the community. So I mean, something that takes a lot of time to build, but certainly has advantages. And like I know here locally there are research sites that like, yeah, and if you're a patient,
I think
considering taking part in a trial, I think you want to know that you're going somewhere that at least has some legitimacy, and can be at least located, online. So I think, yeah, that's probably, again, undervalued by a lot of small research sites.
So I'm curious. I definitely see how marketing branding is beneficial to recruit patients. Is there any offerings, say, to recruit studies? Is there a way to market and brand your site to a sponsor?
Yes. So that's where the other part, some part of our development comes in, some part of marketing comes in. Again, now there are some big sponsors. So there's a short-term game and there's a long-term game, right? So in the short term, there's no way that you can attract big sponsors. You can't attract Pfizer or GSK or Lilly just by saying, oh, like, we're doing this and putting something out on social media or your website. So you have to build credibility, like Brad said, that it takes a little bit to build that credibility. So that's a little bit long-term game where people see you as a voice. People see you as, like, someone that has a lot of information out there, that people are liking, following, seeing, just seeing their website. Are you showing up when people are asking questions about different disease states and things like that? Then there are your smaller sponsors. Those are very, very easy to target through the SEO. So think from a sponsor CRA perspective. You're a small sponsor. You're looking for sites that does atopic dermatitis clinical trials. How are you going to search them? What's your approach? So put yourself in the mind of a small sponsor who's looking to conduct trials. What's their ideal way of searching the patient, searching the sites?
That's
So
exactly. I'm sorry, Chris.
I was just going to say, I was going to give them a plug. So for those sites that are research naive or needing more studies, come and see the DAX booth, right? You guys have a booth. The booths are easy to find. They're at the main entrance. So come and see Faiz and Kazir. Kazir?
Kizzer. No, you're
Kizzer.
close.
Sorry.
No worries.
So come and see them both, and maybe they can help you get some studies.
Yeah, I was going to mention that because it's much easier for this. I mean, I don't even know, because the communication sometimes is not there. So you have it. You will be the middleman in between the sponsor and the sites. That oftentimes some sites or I mean, and even experienced sites, when it comes to new sponsors, they might not have that person or that contact, and this will be a good a way for them or for us as sites to connect with sponsors, especially if you don't have anyone in connection with any specific sponsor that you have any interest on.
Yes, but more than like just getting the studies, like I don't want you guys to confuse us as a vendor that's bringing in studies, but it's more so of building your credibility so that people can find you. Because if people cannot even find you, they're never going to be able to give you a study. So rather than as a vendor, yeah.
Will this be part of building the site reputation, basically, right? To get the site out there.
Absolutely. Yes.
Okay, and that's very, very, very important.
Yes, just building the infrastructure for the site. And it's not just about like having a strong website or just a social media or something, but it's about the credibility that people see you with. I think, like, how many of you shop on a website that is not working, doesn't have a certificate of security? Everybody shops through Amazon. If you're looking through something else, you're going to look maybe on some Walmart or Target or something like that, established brands. But it's very difficult for you to even trust someone who doesn't have an online presence. So same goes with the patients, same goes with the sponsors. Sponsors, this is the most important thing to them, the clinical trial, that's their pipeline, that's their future money. They're not going to trust you if you have not invested in building your credibility. You can't do it afterwards. You can't jump from the plane and then expect that we're going to make the parachute while we're at it. You have to jump with the parachute. You have to have the plan and infrastructure.
Yeah, no, I love that. I think those are perfect final words because we're at time. So guys, go check out Digital Auxilius. I call you guys DAX. I don't know if you're still going by that, shortened or not. And
Yes.
go, reach out, find out about Syncora. I'm going to look into it myself, honestly. Otherwise, excited to see you guys in just a couple of days in Oklahoma City. And thanks for coming on, guys, and thanks for being second-time sponsors.
Yes, thank you
Yes,
so much
thank you
for
very
your
much.
support
Thank you.
since the
Looking
very
forward
first
to
one.
seeing you again.
Amazing. Looking forward
We'll
to
see you there in Oklahoma. Hopefully the weather's nice, Brad. You better make it so.
Hey, man, it's beautiful right now. If it gets worse, then I blame you guys for bringing it with you. So.
We'll see you all there.
Smiles.
All right. Thanks, guys.
Take care.
I don't know who's got the stream end button. Not
Oh,
me.
I do. My bad. I was thinking you're
Come
doing
on,
it, Brad.
Chris.